Here's a 38-year-old male who's playing soccer yesterday. He collided with another player and he felt 3 kind of cracks in his right arm, basically in the region of the biceps. Here we're looking at the biceps muscle in an axial plane, and as we go distally, we're just trying to follow that ovoid hyperechoic structure, which is the tendon, and then you get this black zone, which is essentially blood in this fluid gap where you have this rupture. Here we can see it in basically 2 different zones because the tendon is diving deep at an oblique angle, so it's not actually 2 separate tendons, it's the same tendon just coiled on itself. Now we're going to switch to basically a sagittal coronal plane somewhere in between those 2. We're following the biceps muscle. You can see the brachial artery underneath, and again you can see this dark and echoic zone, which is essentially hematoma sitting above the recoiled tendon stump of the biceps brachii muscle. Here is an axial MRI. You can see on the very left hand the biceps muscle with the biceps tendon. It looks relatively okay at this point. And now we're going distally again towards the radial tuberosity, and you essentially just lose that biceps tendon. You lose that dark signal ovoid structure as you go distally, and that's essentially because it's ruptured. Now we're going to go ahead and switch to a sagittal view where you see a lot of this high signal, which is essentially where this rupture took place. You could see some of the recoiled biceps brachii tendon approximately. So now we're going distally. We're just following the muscle belly of the biceps, and you can note the underlying brachialis muscle as well, which is really just directly over the elbow joint. And now we're showing this tear, essentially a full thickness rupture of the distal biceps tendon off the radial tuberosity. And the patient did get surgery by one of the orthopedic surgeons in my group for this. Here you can see that distal biceps tendon stump. He does have a whip stitch around it, which goes through a biceps button, which essentially fixates it to the radial tuberosity. Thank you so much for watching this video. If interested in the full version of this video, please visit probeultrasound.com or my YouTube channel, Dr. Scott Weiss, and please subscribe to the channel. Also, if interested in finding out information about upcoming musculoskeletal ultrasound conferences, please visit probeultrasound.com. Thank you so much.